Welcome to the University of Michigan Dentistry Podcast Series, promoting oral health care worldwide.
Gary.
Hello, Doctor.
Dr. Gerstner. I've been looking at your chart and I see that you have a chief concern of some worn teeth. Can you tell me a little bit more about your dental wear and where you think it's coming from?
Well, I think it's coming from stress. Because I find myself clenching and grinding my teeth during the day at work, and also at night. It keeps my wife up, and she hears me grinding.
How often does that occur?
She claims every night.
And do you know how long that's been going on?
Oh, probably 5 years.
5 years?
Mm-hmm.
Anything that you think might have brought it on?
Stress.
Stress.
At work.
So stress 5 years ago began.
Well, I lost my job
you lost your
because
job.
the pharmaceutical company that I worked for locally downsized. So I lost my job.
Well, let me have a look at your teeth.
Okay.
And see just what we're dealing with. Okay, let me have you open for me and bite together and move your jaw side to side. Oh yeah, I can see definitely where now. Let me have you open again. Okay, do you have any pain associated with this?
No.
And have you ever had any clenching and grinding problems before the 5 years that you're aware of?
My parents said that when I was a small child that I was doing it then.
Okay, so this does maybe extend all the way back into childhood. So when your wife is woken up by this clenching and grinding, that's pretty severe. Do you have any other sleep problems that you're aware of?
She says that I snore
Okay.
an awful lot too.
Okay. Do you know if you sleep on your stomach or your back or your
On my back.
on your back?
And she
Okay.
claims that I toss and turn too.
All right. Okay. How much sleep do you get a night?
Oh, probably maybe 4 hours.
Okay. Does that seem sufficient? Some people need 4, some people need 12. Are you?
No, because, I think that it's not, what people might call the restful kind of sleep, because when I get up in the morning, I feel tired. So when I go to work, I feel tired, even though I had sleep.
So how's your motivation and concentration at work?
Concentration seems okay. Maybe I over-concentrate because of the grinding.
How about motivation?
At work?
Yeah.
It seems to be okay. I like what I do.
How many hours of TV a day do you watch?
When I get home, probably 5 hours.
Okay. And do you think your mood is affected by the stress?
I think so.
And how would you describe your mood?
Right now, it's, I have a tendency to worry. I know I'm not happy.
You like your job, but it's obviously the fact that your job isn't what you'd like it to be.
Well, no, because right now I'm working just with grant money.
Okay.
And that can stop at any time, and then I lose my job again, and I've got 3 teenagers at home that I'm concerned about sending to college. So I've got that worry.
So a lot of stressors.
Oh, yeah, absolutely.
Absolutely, yeah. I'd like to think about look at your sleep habits a little bit more. If you're snoring, how long have you been snoring that you're aware of?
Oh, for quite a long period of time, probably within the last that job loss, the 5 years. My wife claims that it's gotten worse in that period of time.
Well, snoring and bruxing and tooth clenching do go hand in hand, so that could be related, that if you're not getting a good night's sleep and you're tossing and turning, the bruxing, the clenching can be occurring in association with the snoring, so that's something we need to be concerned with. A bigger thing to be concerned with is the fact that snoring in association with stress could be linked to cardiovascular problems too. Do you know what your blood pressure is?
Well, it's high.
So you do have hypertension. Are you being treated for it?
No, because it isn't a constant thing. It seems to kind of go and come in periods of time, and my doctor really doesn't seem concerned enough with it to put me on any kind of medication.
You know what your cholesterol level is?
I don't know, but he says it's high.
Okay, all right.
I don't know what the number is, though.
So you haven't been treated for the high blood pressure because it's not constant. I think I'd like to talk to your doctor about that, because there are some links in huge percentages of the population between hypertension and sleep problems, hypertension and snoring. Snoring may indicate other more severe problems with sleep apnea. I don't know if you've heard of that before. But
I've heard of it.
Is a severe form of snoring.
Well, I've heard of the term, but I really don't know what the condition is.
Yeah, it has to be diagnosed with sleep studies, which takes a couple of days to do, maybe one night of sleep in a sleep lab. There may be other ways that your doctor has and can suggest to looking at that, but it could be that the snoring is leading to the bruxing, in which case we would like to be able to treat the snoring first, and then the bruxing will take care of itself. So I think I should probably have a discussion with your primary care physician about that. We may be able to come to an agreement that we'd like to have you do a sleep study just to see if in fact you do have sleep apnea. And then the sleep apnea can help resolve those episodes of hypertension that you're having. And we'll see, and that treats the physical component. You know, if we've made the appropriate diagnosis, we'll be able to take care of the hypertension through sleep hygiene, which means that we'll get you a better night's sleep, and that'll lead to a reduction in your snoring and hopefully a reduction in the bruxing. But the stress is also something that we need to think about too. The stress may be causing you to have poor night's sleep. What do you think about that? Is that probably a link?
Well, it probably, I would say it's a very good possibility, but what do you do about stress?
Yeah, what do you do?
How are you going to treat stress?
Yeah. You can't get rid of stress in your life, but there might be effective ways that you can manage stress. So I would suggest maybe we look at a physical therapist who might be able to give you some relaxation techniques and biofeedback methods that might help redirect the stress from your cardiovascular and bruxing components of your life into some other areas, so that the stress isn't going to feed in to the cardiovascular and bruxing components of your life. So my suggestion would be I'll talk to the physician first, see what he thinks about doing the sleep studies, because I think that'd be the way to go. And with the sleep study information, we can make sure that we're on the right track. And if we're on the right track, we can see how the bruxing manages itself. If the bruxing disappears with the treatments that the neurologists that are running the sleep clinic could suggest, then we're in great shape. Then we can come back to the physical therapy if something else is needed. And have you ever had a bite splint for your bruxing in the past?
Well, I did. My dentist made one for me a while back, but it never fit very well, so I didn't wear it for very long. And
It doesn't stop the bruxing. It prevents further wear on your teeth. So it's not a primary, in my opinion, it's not a primary treatment. If we can get these other things taken care of and the bruxing disappears, that's great. We'll think about a bite splint as a secondary choice, especially since you didn't have a favorable experience with the first one. We'll only use that as an if and when. Yeah. Any questions or concerns with anything?
Well, I don't really fully understand what sleep apnea is. What do you? What happens?
Snoring is basically an obstruction of the airway during sleep. As you relax, the airway changes its shape, the muscle tone changes, and so that the air has difficulty flowing through. If it's completely obstructed from flowing, then you have sleep apnea. So if you've got snoring, that's an indication that you're getting close to sleep apnea, and it could be that you are getting some sleep apnea events, and it takes very few of them. And some studies have even suggested that if you're snoring, you're already into, you could also have hypertension potentially. And the snoring will affect how deep you sleep, and if it prevents you from going into deep sleep, you're more easily aroused from deeper to lighter sleep, and it's during those periods of time when you can have bruxing events as well. So snoring, or you can think of sleep apnea as a severe form of snoring. And since we already know you're snoring, there is every reason to believe that that could be related in some important ways to the bruxing habit. So the sleep studies will just help us to confirm what level of sleep apnea or snoring you're at and whether they're playing a role in your bruxing. We can find all that out from a sleep study, and that can be extremely useful. And also whether there's a correlation between hypertension events during your sleep and snoring. And that'll also be very important.
So that all plays a role?
All plays a role.
Really? I didn't realize that.
So we just, and that's of course at a population level, but we want to determine whether within you as an individual it's playing a role, and the sleep studies will help us get there.
Well, I'm willing to try anything because I definitely want to stop doing the grinding and the clenching, and I definitely want to make my wife's sleep more comfortable at night too. You know.
Yeah, so there may be one treatment that can take care of a variety of different problems, and that'll be quite good to find. Any other questions or concerns?
No, I don't think so.
Okay, great. Thank you very much.
Okay, thank you.
You've been listening to a production of the University of Michigan School of Dentistry. For more information about Michigan dentistry, visit us on the web at www.dent.umich.edu.